Hello, everybody. Thank you to our audience and partners for joining us today for this exciting launch of the Research Consortium for School Health and Nutrition. I'm delighted to welcome you and our many eminent speakers for what promises to be an inspirational event. We're incredibly proud that with this launch, the London School of Hygiene and Tropical Medicine, the UN World Food Programme, and Dubai Cares will create a global partnership, a unique one of academic, scientific, and technical institutions and individuals to promote quality research on the health, nutrition, well-being, education, and development of school-age children and adolescents. This goes right to the heart of our mission. And the timing couldn't be more urgent. The COVID-19 pandemic has triggered the worst education crisis in peacetime in our recent history, with more than 1.5 billion children, suddenly excluded from education. In January 2020, just before the beginning of the pandemic, nearly 1 in every 2 primary school children worldwide received a meal every day at school. By April 2020, around 370 million children were missing out on what often been their only dependable daily meal. COVID-19 risks shattering hard-won gains in health and development. Investments in school health and nutrition are vital in their own right, and given well-nourished children are an important investment in a country's development and future. While investment in the first 1,000 days of life is recognized as a priority, the pandemic has helped highlight the need to go beyond that and highlighted the importance of health and nutrition during the next 7,000 days of child development, crucial years for education outcome. The evidence base of that is growing every day. The launch of the Global School Health Research Consortium is taking place during a key turning point of the COVID-19 pandemic and its adverse impact on health and development, in which decision makers and governments are in need of solid evidence to help prioritize investment in game-changing intervention and solutions, and where equity in the world should be really at the top of our concerns, considering, for example, the inequity in terms of vaccine access. Solid research on what works best is crucially important, therefore. With resources often scarce and with many competing interests, the consortium will promote credible and independent research to facilitate evidence-informed decision-making on school health and nutrition. This is what policymakers need, what those who allocate resources need, and those who implement programs. So thank you again for joining us, and congratulations to this exceptionally important launch. A special thank you in particular to Professor Bundy for his leadership and for bringing us all together here today. I remember very well when we discussed you joining the school coming from the World Bank, and this was clearly already on your mind, and now it has come to fruition. Many congratulations. Now, without further ado, I'm pleased to introduce our first policy panel, and the panel on the explaining the Coalition for Action and the Research Consortium. And the first 3 speakers are all members of the School Feeding Coalition, of which the Research Consortium is the first of 4 initiatives to be formally launched. The first speaker is Minister Skinnari, the Minister for Development Cooperation from Finland, who will address us in a pre-recorded video. Over to the video, please.
Excellencies, ladies and gentlemen, it's a great pleasure for me to address the launch of the Research Consortium on school health and nutrition. I would like to start by expressing my sincere thanks to the London School of Hygiene and Tropical Medicine for taking this initiative of leading consortium as this effort is really important and timely. There is a lot that needs to be achieved on school feeding. COVID-19 has left an estimated 370 million school children, almost half of them girls actually, without school meals. Often their only meal of the day. In addition to this, 73 million children from the poorest countries didn't have access to school feeding even before the pandemic. Furthermore, there is room for improvement in many existing school feeding systems, also in high and middle income countries. This year, I'm honored to act as the World Food Programme's Global School Feeding Champion, and in this role, my ambition is to raise awareness and generate resources as well for school feeding. Jointly with WFP and member states, we have started building up a global coalition for school feeding. The goal of the coalition is to reach a situation where every child has the opportunity to access a healthy meal every day in school by 2030. The first aim of the coalition is to achieve tangible results on school feeding in the Food Systems Summit in New York next September. The process of forming the coalition has started well, with several countries already having joined the initiative and many more in the process of joining. I warmly welcome also the London School of Hygiene and Tropical Medicine and all the other research partners into the coalition, as I see that they are a very crucial part of what we are trying to build together. As a key element of the coalition work, we need better and higher quality evidence and analysis. The health and nutrition of school-aged children has been neglected in global research for too long. It's excellent that the London School of Hygiene and Tropical Medicine has started to coordinate the efforts of academia, think tanks, and research partners. I'm sure a lot of synergies can be found this way. We really need to look at this as a long-term project in order to achieve transformative change for school feeding and food systems. But at the same time, yes, we have to take short-term actions. In Finland, we have our own strong experience on the benefits of school feeding. In the beginning of the 20th century, Finland was a poor country where 40% of all 15-year-olds were illiterate. School feeding was a transformative social innovation of its time, and Finland has now been providing free of charge school meals for over 70 years. School feeding programs are a key part of the Finnish education success story. We know by our own experience that the benefits of school meals go far beyond a plate of food. We have gathered the Finnish experience in a study titled School Meals for All. The Finnish school feeding model and expertise could be utilized by those countries wishing to develop their school feeding systems. For example, study tours and other forms of technical assistance could be provided. This is the first long-term initiative to be launched under the Coalition for School Feeding and as part of the Food Systems Summit process. I hope today's discussion will be fruitful in taking forward the research agenda on school feeding and school health for the benefit of vulnerable girls and boys everywhere. Thank you so much.
Thank you very much, Minister Skinnari, and for your leadership as chair of the member countries coalitions for school feeding. Our next speaker is from Peru, a country that has really a strong record in supporting child development. And Minister Silvana Vargas, Winstanley, over to you. Thank you for being with us.
Good morning, everyone. Thank you for inviting us. Evidence-based social policies do promote well-being. Let me briefly share with you 3 remarks based on the Peruvian experience. First, we departed from a sound life cycle and outcome-oriented policy framework. Second, we committed towards evidence generation as part of the policy cycle, policy-making cycle. And third, we designed a set of social interventions that promote people-centered outcomes. Among these outcomes is children and adolescent well-being. To attain these results, in 2012, Peru started a national school feeding program called Jaliwarma, that in Quechua, one of our native languages, means vigorous child. Jaliwarma is a $480 million intervention that reaches over 4.2 million students attending public schools. The program has a twofold goal. It provides healthy breakfast and/or lunches and promotes, at the same time, school retention. To boost its outcomes, in 2019, the program initiated an impact assessment, an impact evaluation. And it arrived basically to 2 main sets of results. At the individual level, the program showed its effectiveness in improving levels of attention and short-term memory, particularly among students that did not take breakfast at home. And at the household level, the program showed that families whose school children received lunch saved around $43 per month per child, which approximately is near a fifth of their monthly income. But beyond the figures at the end, what did we actually learn from this impact evaluation experience? On the one hand, in terms of the process as such, the evaluation benefited from valuable WFP technical assistance that included an international expert panel that contributed throughout to guarantee a robust methodology and sound, thorough analysis. On the other hand, the program conducted a unique result management strategy that reflects basically in 3 aspects. Conceptually, it readjusted its model of school feeding services and included the promotion of local economies. Operationally, it strengthened local monitoring and adopted digital tools for decision-making. And institutionally, it improved governance mechanisms associated to food acquisition, supplies payment, and capacity building of all relevant actors. Thus, the launch of the Global School Health Research Consortium is a great opportunity to consolidate research collaboration around common policy goals and promote, of course, global evidence for better decision-making. We are truly happy to be here this morning. And as I said at the beginning, evidence-based policy promotes well-being, and that is something that, despite all, I assure you, we are not willing to let the pandemic take away from us. Thank you.
Well, thank you very much, Mr. Vargas, and for bringing this all too rarely policies informed and evaluated, by evidence. Thank you so much. We're also very, very happy that France is joining us, also with a long track record in school programs, both in France, but also internationally. It's a pleasure that we have here Madame l'Ambassadrice Céline Jurgensen, the permanent representative of France to the United Nations in Rome. Over to you, Madame l'Ambassadrice.
Excellence, Monsieur le Directeur, cher professeur, Baron Peter Piot, chers panélistes, je suis honorée et heureuse de participer aujourd'hui au lancement du Consortium mondial de recherche sur la santé et la nutrition en milieu scolaire. C'est un enjeu majeur, alors que des millions d'enfants, en particulier des filles, risquent d'abandonner l'école à cause de la pandémie. Dans un contexte mondial où la faim ne cesse d'augmenter, il est essentiel d'accroître nos efforts collectifs pour atteindre les objectifs de développement durable en 2030. L'alimentation scolaire est une proposition concrète qui présente un fort potentiel d'impact systémique. Garantir la santé et la nutrition de chaque écolier est un investissement indispensable pour les générations futures. La France a une tradition de longue date en matière de restauration collective, en particulier d'alimentation scolaire. Au-delà de permettre l'accès de chaque enfant à des repas nutritifs, notre système national d'alimentation scolaire s'inscrit dans le cadre de politiques publiques de lutte contre la pauvreté notamment, à travers des tarifs adaptés aux revenus de chaque famille, mais cela s'inscrit aussi dans un objectif d'éducation à l'alimentation. Cette dynamique est toujours en cours et favorise la transition vers des systèmes alimentaires plus durables en intégrant des considérations environnementales. Et ces programmes bénéficient aujourd'hui à un enfant français sur 2. C'est dans ce contexte que le président de la République française, Emmanuel Macron, a exprimé le soutien de la France à la coalition pour l'alimentation scolaire initiée par le Programme alimentaire mondial et sa volonté de mobiliser la communauté internationale en faveur de ces programmes. Il a renouvelé cet engagement lors de son entretien avec le directeur exécutif du PAM la semaine dernière à Paris. L'alimentation scolaire est à la croisée de nombreuses thématiques sur lesquelles la France est très engagée à l'international, notamment l'éducation, l'égalité femmes-hommes, la lutte contre la nutrition. Cette multiplicité et cette complexité des enjeux liés à l'alimentation scolaire rend aujourd'hui nécessaire la création du Consortium mondial de recherche sur la santé et la nutrition en milieu scolaire mené par la London School of Hygiene and Tropical Medicine. Et je souhaite saluer à cet égard le professeur Bundy. Il est indispensable de penser et d'étudier l'alimentation scolaire en tant que sujet de recherche à part entière dans une approche interdisciplinaire. Dans un contexte mondial où les financements publics et l'aide au développement peinent à faire face à l'étendue des besoins, il est nécessaire de développer et de penser des programmes efficients. La recherche joue un rôle crucial. Le travail que le consortium de recherche lancé aujourd'hui va entreprendre est donc essentiel pour que la communauté internationale puisse mettre en œuvre des programmes de qualité et fondés sur des données scientifiques étayées. Je suis très heureuse de voir la mobilisation des instituts de recherche français au sein du consortium. La recherche française est reconnue pour sa riche expérience concernant les effets bénéfiques de la restauration scolaire sur la nutrition des enfants, mais aussi l'agriculture familiale, les chaînes de valeur agricoles locales. Les instituts français pourront aussi mettre au service du consortium leur réseau de collaboration scientifique internationale particulièrement dense, notamment dans les pays francophones d'Afrique. Il est en effet essentiel de mobiliser une grande diversité d'institutions scientifiques dans l'ensemble du monde. Nous avons besoin de la mobilisation et de l'investissement de chacun des acteurs. Ensemble, nous pouvons faire en sorte que chaque fille et chaque garçon puisse avoir accès à des repas scolaires de qualité. Je vous remercie pour votre attention.
Un grand merci, Madame l'ambassadrice, et aussi pour souligner le besoin d'une approche multidisciplinaire et de souligner la grande expérience que la France a et donc sera essentielle comme contribution à cette coalition. Grand merci. Now, the next two speakers are members of the coalition and also founding members of the donor partnership that supports the research consortium. It's a great pleasure to introduce Dr. Tariq Al-Gurg, the Chief Executive Officer of Dubai Cares. Over to you, Dr. Al-Gurg.
Thank you very much. Apologies, I had some technical difficulties earlier, so apologies for that. But hello, everyone, and it's good to see you again and see new partners, of course, joining this consortium. And finally, the dream Dawn, Bundy, and I had more than 8 years ago has become a reality, even greater than what we had envisioned around that time. So Dawn, good to see you here again. Since the inception of Dubai Cares in 2007, we always wanted our organization to be an organization of continuous growth with an emphasis on learning and sharing knowledge at the same time with all. We learned through our journey that the only way we can build our capacities is to learn from others. A core aspect of this has been a commitment to gathering and disseminating evidence from the sector and for the sector. That was the most important thing, hence culminating in our commitment to research. Dubai Cares has always been perceived to be a pioneer in the sector with a significant commitment to research as a core pillar. We invested more than $17.5 million only in the last 5 years towards research. We evolved as an organization throughout these years due to the strong collaborations we have had with our partners and people like yourselves. And that brings us to where we are today, basically. The work of Dubai Cares over the last 14 years has contributed to a massive change in how the world views the roles of health and education in the creation of human capital. This is one of the most important areas in which Dubai Cares support has led to a series of lessons for us and our colleagues involved with us in some of our programs. We all recognize that investing in learning needs to be leveraged by investing in the learners. They are both essential. They are both two sides of the coin. Investing in the learner has never been more essential given the global pandemic that we're living nowadays. This challenge has had a huge impact on school children, not only on their education, but also their well-being, be it mental or physical, from a health and nutrition point of view, of course. This prompts us to look at ways to re-emphasize the efforts that are emerging as a response to the pandemic's effects on learners. It also acts as a reminder for us to investigate and learn from our shared experience during this pandemic. This pause of life somehow has given us the ability to reflect on what we want school feeding and school health and nutrition programs to address, and how we can incorporate that we have learned from the absence of these programs in the last year into our way forward. And having said that, the whole thing would lead to our support for the Global Research Consortium as a source for knowledge and collective learning. It should also serve as a vehicle for progress and more effective return to school feeding programs as we move slowly towards reopening schools globally. This consortium will provide guidance not only to London School of Hygiene and Tropical Medicine or the WFP or our organizations, but it will also prove to be an invaluable support to guide ministries of education, ministries of health, and implementers at large. And although Dubai Care's mandate is to support SDG 4, it became apparent early on that quality education cannot be achieved globally in isolation from school health and nutrition. And before the pandemic, we were facing an education crisis globally. Now, additional 24 million children and youth could drop out or not even have access to school next year due to the pandemic's economic impact alone. If we want to achieve SDG 4 by 2030, we need to be bold. We need to innovate. We need to disrupt with new ideas. And above all, we need to work together. We welcome the effort of the academic sector in driving this agenda forward with us. We believe that the collective intellectual capacity we have today will significantly advance the school feeding agenda with a focus on the learners themselves. And while we are still in the middle of the pandemic, today's research consortium will gather the evidence of the impact and support governments in providing data, lessons learned, and best practices on what can work to support and increase the effectiveness of the recovery efforts and beyond. I wish all the success to everyone involved in the consortium, and I hope that today's launch will be a historic one for school health and nutrition. Thank you very much.
Thank you very much, Gurg, and for your real strong leadership and support. Now, next speaker is from an organization I worked a lot with and I admire with, that it's a World Food Program. Carmen Burbano, who is the co-chair of the board of the Research Consortium with UNMILS. Over to you, Carmen.
Thank you very much. Thank you all for being here. And I want to be very brief because the speakers before me have done such a great job at explaining why this endeavor is so important. I think we all know now how groundbreaking this initiative is. The World Food Program is honored and proud to be a founding member of the School Health and Nutrition Research Consortium. As has been said by many speakers before, this endeavor has been in the making for a number of years. Personally, I have to say my connection with this issue started in 2009. And since then, we have had this endeavor, this research consortium in mind, with partners such as the World Bank, the Partnership for Child Development, UNESCO, UNICEF, and others. We embarked on a journey 15 years ago of strengthening the evidence base for school health and nutrition programs. At the time, there was really a gap, a very big gap in terms of what these programs could achieve. 15 years later, that evidence is very strong in terms of outcomes. We know these programs yield benefits at least for 4 or 5 sectors, including education, health, nutrition, social protection, agriculture, and gender equality. There is a very strong evidence base to tell us that this is so and that these programs are good investments. The problem is that we have yet a lot to do in terms of helping decision makers like our Peruvian minister make better decisions for their programs. There's a lot of operational questions that we still need to answer, understanding the trade-offs of these programs and how they can be better designed on the ground, understanding what are the cost efficiencies that can be found, especially in low-income countries, and how these programs can be made more efficient in terms of multi-sectoral choices are some of the questions that we still have to answer. So this research consortium today, we hope, is a 10-year or plus endeavor. It will really put us on the path towards the next round of SDGs, where we really hope that school health and nutrition is going to be prominent on that new development agenda. This is a very long-term vision that we have. The World Food Program is thankful to Professor Ann Mills, to Professor Piot, but especially from an organization point of view, but also a very special personal point of view, our partnership with Professor Don Bundy and his leadership of this endeavor, but also a 20-year partnership with WFP that has to be highlighted today. I, again, very much salute this initiative and wish all of us the best in terms of really moving forward on this issue. The children in the world depend on us.
Thank you very much, Carmen, for the continuing commitment. WFP, and also the long-term view. I think indeed this is something that we must really make sure that it's with the commitment is for the long term, because there are no simple solutions here. Now we have three presentations of the Global Research Consortium, and we're very honored that former Prime Minister Gordon Brown, who is also the UN Special Envoy on Global Education, has been so gracious to record a message for us. Over to Prime Minister Gordon Brown.
When I was hungry, you fed me is not only a much-loved text in the Christian faith. Feeding the hungry is a sacred injunction in every religious faith. And if we're to be the first generation in history to achieve two great humanitarian goals, ending extreme poverty and getting every child into school and learning, then every single child must have the opportunity to access what is perhaps the most impactful and effective safety net to support children: healthy meals every day in school. In low and middle income countries, every dollar invested in school feeding yields $9 back in social returns as healthy and educated children become more productive adults. Yet since the start of the pandemic, more than 39 billion in-school meals have been missed, and 379 million children have been suddenly deprived of the main and sometimes only meal of the day. A silent tragedy for children's nutrition that will come back to haunt us. But even before the pandemic, despite 388 million students receiving meals in 161 countries, 73 million of the most vulnerable girls and boys in 60 lower income countries were not being reached. To repair this damage, we need now to mobilize nearly $2 billion in international aid to restore access to school health and nutrition programs for those children by 2022, and to ensure the 73 million additional children who have been left out are now fed. We will need the support of the soon-to-be-launched Global Coalition for School Feeding, as it brings together all who can contribute, and the new research consortium, whose formation I applaud the London School for Hygiene and Tropical Medicine, will be working with a dedicated task force under the Global Education Forum that I co-chair, and it will map the current available global financing for health and nutrition programs, and it will develop a financing and delivery plan so that instead of developing only some of the potential of some children in some countries, we nurture and feed all the potential of all children in all countries.
Thank you very much for that strong message, Prime Minister. Now over to, well, the person who made it all happen, and together with many others, of course. Over to you, Don.
Well, it's thank you for all these kind words, much appreciated. It's also extraordinary to hear policymakers so consistently talk about the importance of research and about evidence. I'm going to have lots of time to talk this afternoon in the 2-hour symposium that follows this, where we'll be trying to set research priorities. So I'm just going to make 2 points: that this is a research consortium that will be independent. This is the goal of the agencies that are supporting us, and it is our goal. And that's why it's housed in an academic centre, and why we're working with academic colleagues to drive this forward. And secondly, that this will be a truly global activity with a focus on the South. And the main tool we're using to achieve this is the creation of communities of practice that truly reflect the countries that are working in these areas specifically. We'll get into much more about that this afternoon, but for now, I think my task really is to pass on to Bibi Giyose, my colleague, with whom I've worked for many years, and Bibi is the AU Development Agency lead on nutrition, and will be spearheading our work in Africa, across Africa, on these programs. So Bibi, if you could fill in your vision for the research consortium.
Thank you very much, John and Don, and I appreciate the words from all the eminent speakers before us. I think from where I stand and from where we stand, research is indeed very central to building the evidence that we need, especially to make sure that all the naysayers that have said school feeding cannot make a change. We do know that today, school feeding is one of the most important and very pivotal change maker in terms of not only child development, but overall national economic development. Why? Because we need to be engaging with everybody that needs to be at the table to co-create the solutions, understand the gaps, and we have evidence out of Africa based on the cost of hunger studies that we have done, amongst other studies, to show that if you don't invest that $1, you will not be able to get many more dollars, but you'll be losing GDP as we don't need to lose. But overall, I think based on the fact that our food systems are different, it also begs the question, how do we design relevant research for the different regions and different countries of the world so that it serves the purpose of really not just feeding the children, but nourishing them and giving them the base for which they can reach their potential and contribute socially, economically, and otherwise to the world. So those will be my short ways, and I really appreciate the contributions and the very wise ways from the previous speakers. So this afternoon, we shall be having in-depth discussions around how we're going to be moving with this. Thank you very much.
Thank you very much, everybody. And over now to Ann Mills. So the key is here, keyword is partnerships. And the other one is evidence and making it happen and working with communities. So now over to Ann for the rest of the program. Thank you so much.
Many thanks, Peter. And I'm delighted to chair the next set of sessions, which will focus on the value of and the need for research. So the first session will address research for policy, and the second, the approach and research needed to fill evidence gaps. In the first session, I'm delighted to welcome Professor David Nabarro to address us for the next few minutes. He is Senior Advisor, Food Systems Summit Dialogues and Special Envoy of the WHO Director General for COVID-19, and he also has a base in Imperial College. David, please.
Great. Anne, it's kind of you to introduce me with so many lovely words. I remember that we started at the London School of Hygiene and Tropical Medicine together quite a lot of years ago, and it's great to be back and connected with you. Also, of course, with Don Bundy, and he and I have just worked on these issues really for an awful long time. And what a wonderful collection of people are here on the screen. Some people who have really worked so massively hard over the years alongside Don and others to bring this issue right up to where it has to be. I want to do four things, if I may. First of all, I'd like to share just my impressions of where this issue is on the global stage, as well as in a number of countries and communities that I'm connected to. I want to say that I think this is a really exciting time for the evolution of meaningful policies around the better health and nutrition of children in schools. Quite simply, it's an issue that's been left behind for too long, and you're all going to bring it right up to the front. And I think that's an issue that really needs to be put into the uppermost part of decision makers in trays super fast. Perhaps to give a little bit of background, there is so much evidence, and you've been summarizing it in the presentation so far, that there are lifelong benefits to individuals as well as to societies if good nutrition and health is experienced in the early years of life. In fact, we've always said from the conception through to the second year of life is vital for that early nutritional grounding. But it continues right on into young childhood, then middle childhood, and then adolescence and young adulthood, because unless there is attention to health and nutrition status at this time, as we know, the consequences in later life are really serious. And I think as research kind of delves more into the links between early life and later performance, we'll see even more associations coming through. And it's not just physical health, it's mental health as well. And we need to all the time be conscious that there's a lot of transformation taking place in young people's brains, and that looking after the mental well-being may well be just as important as the physical. Now, COVID-19 has come along and is really a most extraordinary and in my view, underestimated impact on societies everywhere. And as we just heard, it's an issue that is still, as far as we can tell, advancing, and the pandemic is nowhere near its end. So let's be clear amongst ourselves that we must pay attention to what's being relieved by COVID-19. First thing, the impact of COVID-19 is incredibly unequal. And what we're seeing everywhere is that people with less power, less wealth, or accompanying illnesses are most likely to be badly affected by COVID. Who has less power and less wealth? Well, it's the children of poor communities and poor households. They're the ones who are perhaps most affected by the COVID pandemic, even though they may not be getting seriously ill. And that's because what happens is that the pandemic just leads to real breakdown in societal systems, and the people who end up being most affected are children. The obvious way in which it's happened is for hundreds of millions of children who were getting some form of nourishment at school, lost that nourishment last year because for more than half the world's population, schooling was shut for at least 3 months, and in some places schools were shut for a year. And all the evidence collected by my colleagues who are focusing on nutrition, it suggests that this has had both immediate and long-term consequences for child nutrition, health and well-being everywhere, not just in poorer countries, but in rich countries. It's poorer households and the children in poorer households who are hurting the most. And yet at the same time, who are going to respond to the COVID pandemic? Answer, it's people. People are the response. The virus is the problem. And so it is absolutely essential that the coming generations are given the best possible opportunity to be able to be strong in the face of this and other threats. And so health and nutrition in the early years is key to a strong society and strong societies that will be able to deal with these kinds of threats. And so that brings me to what for me is the most exciting and my concluding remarks, most exciting point that we're in right now. In September this year, the United Nations Secretary General is hosting the first ever World Summit on Food Systems. You've had it referenced already. This will bring together heads of state and government from as many nations as can convene at the end of September to focus on the steps that need to be taken now so that food systems can move to where they should be by 2030, when the SDGs are to be realized. Now, as countries are preparing for this summit, so they're involved in a lot of technical work around some very well-developed action tracks that are identifying priorities. And one of the priorities that's come through very strongly through the action track focusing on nourishment is the importance of ensuring that children, when they are in school age, have adequate access to nutrition, and therefore an initiative to greatly increase school feeding has been put on the table. France and Finland are driving that initiative. I'm delighted the ambassador of France is here, because this is going to be an absolute game changer. More and more countries are coming on board because I am connected to them through a program of food systems summit dialogues taking place in more than 125 countries. And as we track the dialogues that are underway involving many thousands of people around the world right now, what's coming through time and time again? Answer, let's make sure our school children are properly nourished. Let's make sure that we prioritize healthcare for our school children. Let's make sure our school children receive the education they need so that they eat diets that are healthy and sustainable. And let's make sure that our children are brought up in an environment where they are encouraged to eat and live as healthy as possible and are prevented perhaps from being sidetracked into routes that are less healthy and less sustainable. Research is going to be key as this initiative is advanced. Thank you so much for launching this consortium. Policy research is going to be vital because this issue is coming into policy in more and more countries, and the details are going to be super important. Again, really privileged to be here. It's an honor and good luck. Thank you.
David, thank you very much, and especially for those encouraging words. So I turn now to our second session, which is a panel which will focus on the value of research in driving evidence-based programming as part of the recovery from the COVID pandemic. We have three eminent speakers, and I'm delighted to first welcome Dr. Roberta Gatti, the Chief Economist of the Middle East and North Africa region of the World Bank, and she'll speak on the importance of data quality in decision-making. Roberta.
Thank you, Professor Mill. And what an honor it is for me to be in such illustrious company today. Today I will share a few reflections on measurement, both thinking back to the experience of co-creating the World Bank Human Capital Index and also looking forward to measurement initiatives that are implementable in developing countries. But before I do this, let me join the colleagues who spoke earlier to say how timely the Research Consortium initiative is now that the pandemic has put at risk the healthy development of so many children around the world. According to the Human Capital Index, which benchmarks the productivity of today's children as future workers, given the health and education risks prevailing in their countries, the generation of children who are in school today stand to lose 4.5% of their human capital solely if we look at missed learning. This loss is in the order of magnitude of the average global gain in human capital in the past decade. So we're talking about potentially a lost decade with a burden that we know is significantly larger for children from disadvantaged backgrounds. So the policies to remediate this and hopefully also to pave the way for a better future are really an imperative. But as this pandemic unfolds, what we also know is that fiscal space is more and more constrained. So this is also, the imperative is also to think about policies that are cost effective and policies that are web targeted. And this is where measurement can help, and it can help in many ways. It can help by generating a shared understanding among different stakeholders of what is the problem. And this is an understanding that is more likely based on facts than sentiment. Second, as policies get implemented, measurement in the form of strong monitoring systems can provide feedback to guide course correction to policies. At the same time, data and transparent information are essential for accountability because they empower citizens to voice demand, to make sure and pressing government and providers so that teachers are prepared to teach, so that doctors and nurses have their competence, tools, and motivation to provide patients with effective care. Finally, good measurement also enables policymakers to target policies to those who need it the most. And we know that often this is where interventions yield the highest payoff. And I must say that I was really touched that these themes resonate with what I heard earlier in the interventions, including in the words of Her Excellency Winstanley from Peru. The good measurement is really that public good that everyone loves when they have it, but no one wants really to pay for. And so let me turn here to some examples of missed opportunities in good measurement, looking back at my own personal experience in building the Human Capital Index. The paradoxical situation where the team and I found ourselves when building this index is that in a world where data never sleeps and 42 million WhatsApp messages are swapped every minute, we had a hard time to build a cross-section of 174 data points, comparable observations about key dimensions of human capital in children, such as survival, stunting, quality and quantity of schooling. So just think about vital statistics. You think this is simple. In sub-Saharan Africa, only 8 countries have coverage of 8% or more for under 5 years old birth registration. Only about half of countries cover at least 90% of deaths. And we've become acutely aware of the shortfalls in vital registry now that we are in the midst of a pandemic, and we need to understand where to target our interventions and thinking. Also, progress has been quite slow. Birth registrations have increased by only 7 percentage points in the past decade. Let's think about stunting, which is a measure of height for age, and many of us who work in this field have used it as an overall indicator of the health environment in which children grow. And we know that it is a good predictor of health and well-being in adulthood. The Joint Malnutrition Estimate Initiative curates global stunting data and reports data for 152 countries. And this is a fantastic and welcome initiative. Yet, it is as good as the data that get into this database. And just for measure, 33 countries have data that are older than 5 years in the data set. And 10 countries, for 10 countries, the most recent surveys is over 10 years old. How can policymakers really make decisions on data that is that old and cannot really inform them about what is going on today? Now, with the Human Capital Index, we were focusing on cross-country comparability and benchmarking. And in a way, at that time, our objective was to generate what has become known as the PISA shock, that realization that things might not be going at all as you were expecting in your country. Along the way, we wanted to bring on board also an important audience, the ministers of finance, because we wanted to highlight to them the productivity costs of not investing in health and education effectively in their countries. Now, with our emphasis in benchmarking, surveys such as the multiple indicator cluster surveys and the demographic and health surveys turned out to be absolutely precious. But this exercise also highlighted to us the important tension that there might be between cross-country comparability and bespoke measurement initiative at the country level. It made us understand that international cross-country initiatives have really a role to try to foster this comparability. At the same time, the harsh reality is that bespoke measurement is much less common than data deserts. And many of the countries where the World Bank operates, data are not bespoke. They're really just not there. And so this is where I would like to turn to some ideas for measurement that might be both implementable at scale and relatively cheaply so in developing countries. An area that is gaining increasing attention in the academic literature, but particularly in high-income countries, is to measure children's mental health. And we know that mental health of children tends to be highly predictive of future outcomes. In developing countries, this literature is just emerging. But being most parent or teacher reported, these measures are relatively easy and not very costly to collect. They are important. And nowhere like today, where children have been cut away from contact from their peers, the question of mental health becomes very important for future development. There's also ample room to leverage more the schools as a sort of service delivery point for health interventions. And my colleagues later will talk more about this, not only for nutrition, but beyond. Just think about screening eyesight and hearing at schools, something that can be done very cheaply, quickly, but that we know has an important impact on learning for children and their self-confidence. Now, these are just examples, and we could discuss many others to expand measurement in the outcome space for children in this age range, from foundational learning to nutrients adequacy, micronutrients deficiency, to menstrual health. We could also think about methods and triangulating better among different sources, teacher reported, parent reported, child reporting, and finding ways to obtain comparable outcomes for children who are in school and children who are out of schools, who are arguably the most in need of our attention. To conclude, I am both very happy about this initiative and very hopeful. It is really much needed because it focuses on the interaction of different dimensions of human capital for school-age children. And we know that it is that interaction that determines the future accumulation of human capital. And I like it that it's so well positioned to translate academic research into real change for children. And I would like to argue that better measurement can be a foundational part of this success. Thank you very much, and thank you for having me with you today.
Thank you very much, Roberta. Thank you. And given the time, I think we should move straight on now to Dr. Jo Puri from the International Fund for Agricultural Development, she's the director of the Environment, Climate, Nutrition, Gender and Social Inclusion section at IFAD. And she's going to speak on the importance of a multi-sectoral approach. Please, Jo.
Thank you so much, Professor Mills, and really such a huge privilege for me to be here. So just first, I think just as a chapeau, it might be useful for me to also indicate that, IFAD is really excited about this initiative, especially because it's really committed to evidence-based policy. I want to use this opportunity to talk about 3 key areas where I think the consortium could really do the policy community as well as the operational community a huge favor. So I wear 2 hats. I also teach in my academic capacity, and I also am working at IFAD. And very, very frequently and very routinely, I find myself at cross ends because I am arguing for evidence-based policy and evidence-based operations. But when I go and look for this, there's a lot of stuff that's missing. So with your permission then, Chair, I'm going to talk a little bit in terms of the 3 key areas that I think future evidence-related missions such as these could really focus themselves on, with the overall background that IFAD itself is, as many of you may know, is really focused on working with small-scale producers. And small-scale producers are integrated into a lot of its own school feeding programs, and it works really hard to try and see as to how these value chains can be created as well as sustained that link small-scale producers that are present in rural areas and can be linked to school feeding programs that are predominantly in rural areas, right? So with that background, the first area that we find that there's very little evidence on, despite, and I know a couple of speakers said this previously, that there is a lot of stuff that we do know about what works with respect to school feeding. And that's to be congratulated. I think the academic community has put in a lot of effort in developing such sort of evidence. But key areas remain that I think we should focus on. One, a lot of this evidence is really in developed countries. And within that, there is a lot of evidence that we do have with respect to the linkages and impacts of school feeding programs on say, educational outcomes and some anthropometric measures and nutritional outcomes, but not so much on psychosocial outcomes and not so much on health-related outcomes, especially in low and middle-income countries. And I'm really talking about high-quality evidence where causal attribution is really easily verifiable and is credible. When I was looking at systematic reviews in this space, and I was looking at the Cochrane Library, the last systematic review that had been registered and that had a protocol was registered more than 10 years ago. And the systematic review was published, I think, about 10 years ago. So it really then speaks to a critical gap in evidence that we have, especially with respect to low and middle income countries, which is really the targeted countries that we all work in. Within that, also, what specific content, so types and amounts of food and nutrients might be focused on with the greatest and the largest benefits and outcomes is really key. So just by way of context as well, most countries in sub-Saharan Africa only have school feeding interventions that are targeted towards the most food insecure regions instead of being universally available, right? So if we are to really expand the coverage of school feeding programs, then clearly we need evidence that can show as to how we can link the quality of existing programs to maximize their benefits on children and adolescents. So that's number one. To essentially say that we've got to focus far more on some of the areas that are underserved by this evidence. The second area that I think that we should be really looking at in terms of greater evidence is implementation research. There's far greater research that is required for us to operationalize this linkage of school feeding with, say, rural small-scale producers, while also looking at other sectors, right? So food, nutrition, poverty alleviation, etc. But really for me, and this is a personal request as well, in quite a few of the programs that IFAD is delivering, for example, in Burundi, in Guatemala, we are looking to use local supply chains and connect them with school feeding. But here, then a lot better evidence and more evidence on how we might be able to integrate some of the learning that we are doing into supply chains, to understand as to what are the best incentives for farmers as well as for caterers that are providing those school meals in schools. So for example, farmers need money as soon as they harvest their crops, but caterers, the ones who are providing food, receive their money after they serve their children. There's also a lack of trust between farmers and caterers, right? There are inconsistent payments from governments that also worsen a lot of the perceptions that are present in this space. It's also very difficult for there to be a common market. So caterers accessing farmers, farmers accessing caterers, concerns related to aggregation, and really creating structures that can help facilitate these sorts of negotiations are really key. So what we really need is greater research that is really looking into implementation for scalable school feeding programs and smallholder procurement.
Jo, I'm sorry to interrupt you, but we're running over time. I'd be very grateful if you could be brief.
Yes, and my last point is really the third area that we've got to look at is a social cost benefit analysis, so that we can help to understand as to what sorts of trade-offs we might make when we are deciding on policy options. Thank you.
Thank you very much, Jo. And again, sorry to interrupt you, but I'm just aware of the time. And I'm also aware that we have a final speaker, who is Professor Michael Kramer, Professor in Economics and Public Policy at the University of Chicago and the 2020 Nobel Laureate in Economics. Michael, thanks very much for joining us, and I look forward to hearing you on the role of school-based programs.
Wonderful, thanks so much. Jo, your last point on cost-benefit analysis, that's exactly where I'll try to take off from. Trying to share my screen, but it seems to be disabled. Let me try it again. Still disabled. Let me start for a minute without slides. You know, one of the I just moved to the University of Chicago. One of the things the University of Chicago is known for is trying to broaden the concept of capital in economics. You know, in economics, it's traditional to divide things between consumption and investment. And often health and education had been traditionally, this had been considered as consumption expenditure, strange as that may now sound. You know, one of the advances that was made in economics here was, here at Chicago, was thinking about health and education, not simply as a consumption expenditure, but as an investment, and hence the phrase human capital, you know, which we've now, sounds very natural, but you know, it wasn't always. This was a shift in thinking. I think this shift in thinking has come partway through, but it hasn't come fully through. And I think one of the things I'd like to do today is to start by presenting some evidence. We're now getting to the stage where we actually are able to follow up some school health and nutrition interventions for long enough that we can actually have experimental evidence to show the economic impact of this. And in some cases, it's truly remarkable. It's not just an investment, it's a fantastic investment. And I think that type of evidence is very useful for policymakers. Let me see if I can share again. Great. Great. Is the screen sharing now properly? Okay, I'll assume it is.
Yes, it is. That's fine. Thanks, Michael.
Thanks. So, one question is this a good investment? Let me mention another issue within human capital theory, if you want to call it that, which is, where are the investments greatest? So some people have argued that there are very high returns to very early life investment, hence the focus on the first 1,000 days. And I think there's very sympathetic to investing in that stage. But there are people who take that idea a step further and argue that we shouldn't even invest beyond that, and that the returns to investment at later ages are not so strong. So I'd like to, in particular, that they're not so strong at the for school-age children. And I'd like to start out by presenting some evidence from a recent paper suggesting that might not be the case, that in fact there might be very high returns to school-age investments. Then I'll then say a little bit about the evidence more broadly. I'll start with an example of a paper that just published, and then we turn to behavioral economics. And here, let me echo what Roberta was saying. I think mental health is a very important area to investigate for the future. Let me start with a very specific case, the case of treatment for intestinal helminths. And these are very widespread problems around the world. 1 in 5 people are infected or at risk for intestinal helminths. And the largest category is soil-transmitted helminths. Now, school feeding programs typically include deworming in endemic areas. That's what the WHO recommends, that in areas where worms are common, all kids get mass drug administration. They can opt out, of course. So quite a long time ago, I was involved in examining an NGO program in which deworming was extended to 75 schools over 4 years. And the order of phase-in was determined experimentally. And we focused on the short-run impact. This was a program that was put in place in the 90s. And we found tremendous impacts on education. Deworming reduced school absence by a quarter. So if you think about human capital as educational human capital, health human capital, this suggests there are important interactions among them and synergies. But if we're really trying to say this is an investment, then the question that perhaps somebody very hard-headed would ask, well, it's great that you're making kids healthier, that you're advancing education, but does that have long-run impacts on income? So we've been following up over time, and we just released the latest round of surveys, which is after 20 years, and this just came out in Proceedings of the National Academy of Sciences. Here's a picture of the deworming back in the 90s. This was, I should acknowledge, in an area with a lot of worms, so I don't want to claim the effects are necessarily the same everywhere. So here's I'm skipping a lot of caveats, especially given the time, but here's an estimate of the cost side. If we think of this as an investment, initially you put in money and you hope you get money out later. Okay, you can see the deworming cost here is trivial. It was less than 50 cents per child per year to do deworming. We actually, and I noted that kid stayed in school. Normally you would think of that as a benefit. We're going to be very conservative here. We're going to think of that as a cost. I don't think the government necessarily spent more on teachers, but maybe kids suffered from crowding. We'll say, what if the government paid to keep pupil-teacher ratios constant? They would have had to put more costs in. Okay, then you can say, well, how much extra earnings would you need for this to be a high return investment? So if we want a rate of return of 10% per annum, you'd be very pleased if your investments got that level. And that's typically the threshold set for benefit cost analysis for, sometimes 5% is used, but again, we're being conservative. We'll say that we wanted a 10% return. Okay, we've been collecting data through the Kenya Life Panel Survey. And initially we could just collect limited data. Over time, we've been able to expand and collect consumption data. Economists earnings data tends to be quite noisy. Consumption data has some benefits. We've collected both. But you see, early on, we just collected the earnings data. You can see that at least the point estimate, and there are wide confidence intervals around some of these, but we have multiple measurements, that was $80. Okay, you can see that dwarfs the estimate of, sorry, that dwarfs the amount needed for this to be a profitable investment. If we look at the consumption data, which we now have, particularly in the latest survey, that's also dwarfs the necessary return for this to be a good investment by narrow economic criteria. So now we don't have data going from 25 to 50 years, but even if we saw no gains in the future, this already would have paid for itself many times over. So one way to think about this is, what's the net present value? After you subtract off all the costs, not the just deworming costs, but the extra schooling costs, this program, which is 50 cents per child or $1, the benefits are between $231 and $468. What about just the extra tax revenue the government of Kenya collected? Well, that's on the order of $17 to $50. So just the tax revenue the government collected from this would have been enough to pay for the program. So the government of Kenya could have gone out, borrowed to finance this program, and come out ahead, even on a fiscal basis, let alone the benefits to the population. That's a very strict, very tough standard to meet. Very few government programs would meet that. The social, I would say one good measure overall is what's the rate of return to this, and that's around 40%. So that is just a fantastic rate of return. Again, if you think about if you got that rate of return on your pension plan, well, depending on your age, but you'd be in very good shape. Okay, so that's looking at deworming. I think partly I've done research on it. I think it's a fantastic investment. It's very tied to school feeding programs. But let me make a broader point. We're now at the stage where we've done a bunch of randomized controlled trials on health and education interventions, and also on conditional cash transfers. And we're starting to get to the point, it's just starting, where we can perhaps make some generalizations. So this table, which I realize is going to be hard, no, I can't expect anybody to read, we did a literature review. These were the papers we found that met our inclusion criteria for long-run follow-ups. And some of these are, if you look at the first 6, for example, these are sort of health, nutrition, human capital investments. There are problems with some of these studies, but if you look at the long-run impacts, we have an annual review on this, article on this, happy to share it. And I hope I'll have the reference up on the next slide. Those are giving pretty good, pretty positive results on long run. The consumption, the cash transfer programs, which, to be clear, I'm not opposed to, those we tend to see a little bit less in terms of long run impact. They may be excellent because we care about consumption, not just investment, but it looks like we're not seeing quite as much in terms of a long run payoff from those. Again, very preliminary results. This is an area where I think we need to get more results. If we can follow up over time, then we can start to understand the patterns more strongly. And here's the reference to our annual review article. This shows the number of randomized controls out there in different areas, and there's a lot of potential for long-run follow-up. So being able to do more of it, I think, is very valuable. Okay, let me turn to another area that I think is very promising, and I'll conclude with this. There was reference to schools as a delivery point, and there was, I think that there can be tremendous gains from using ideas from behavioral economics. And here I'll use an example. Again, I think it's not just an example, it's very important in its own right, but I think we could do this sort of thing more generally. we can find one of the key lessons from behavioral, changing behavior on a sustained basis is very hard. It's not easy. Hand washing is an example of something we know is important for health, but it's hard to get behavior change. A lesson from behavioral economics is if you can make things as convenient and easy as possible, and of course free as part of that, then that can potentially make a difference. But design to make this easy can also play an important role. And this is an approach that was also worked on dispensers for water treatment solution, which did yield sustained behavior change, taking clean water take up from sort of 7% to 50%. Here's something that I think is much earlier stage, but I think very promising. This is something that creates that can be used where you don't have running water, and I think we all know sort of the very complicated procedure. Water has to go be collected. The traditional way would be there's a basin, you pour that over another basin. If you're in a somewhat formal setting, it's not an easy process. Okay, it's not something you can expect school kids to do. And soap gets stolen. Soap is at a setting like a school, getting it resupplied, not easy. So this is something that produces a foam that's actually a lot of, kids report that it's fun to use. This is all just pilot results. We haven't done a full randomized trial. This was done with a prototype, but it could be produced at scale and to higher standards very easily. In the pilot, we saw a 6-fold increase in hand washing. This was 20 schools before and after. It's very preliminary evidence. But I think this type of approach, we now have evidence that it's feasible, and that at least preliminary evidence that it can increase hand washing tremendously. I think it's worth testing out this and other approaches that could potentially be scaled up that are so that we can expand the set of school health and nutrition approaches. I would to come back to Roberta's point, if we think about mental health, there are a bunch of approaches that can be tried that are very, very low cost, including some that can be delivered over digitally. But a purely digital system often isn't going to work. You need humans to make those referrals. Well, this is obviously very early stage and speculative. But if you could work with the schools, with the Ministry of Education, you could get teachers and principals to perhaps identify kids who are having problems and suggest, this might not work in the lowest income countries, but in middle income countries, a lot of these kids will have phones, they'll be on WhatsApp. You could then have a digital system that could work with them and perhaps yield some improvements for them. So I think testing, totally agree with Roberta's point that we need to be trying to develop mental health approaches, particularly for teenagers, where a lot of these problems kick in. And you could take advantage of the infrastructure schools provide and the infrastructure that school feeding programs provide to start experimenting with this and to get data. And then that could potentially be radically scaled up, as deworming certainly has now reaching in many countries and reaching hundreds of millions of children every year. Thanks very much.
Thanks very much, Michael. And thanks for making such a strong case for the value of investment in human capital, as well as for sharing your latest research findings. So this is now the end of the public launch, and I hope that you've all been inspired as well as informed by our distinguished speakers, and that you will all join in supporting this huge global priority of school health and nutrition. So thanks very much to our speakers, and thanks to you all for listening.